Join us at the Healthcare in the Age of Personalization virtual conference on May 3 to 4.
Two massive shifts are happening in healthcare simultaneously. A shift to value, making us more accountable for individual health outcomes, and a shift in demographics, a shift in the very populations of individuals whose health we're all accountable for.
We're bringing together some of today's top healthcare executives, patients, and practitioners to discuss how to provide better care and experiences in today's age of personalization.
Healthcare is in the middle of a transformation right now. We have a lineup in today's summit of nationally respected healthcare leaders.
I think we have to change the definition of health. We have to think about the social and economic and educational outcomes as well as the health outcomes.
Learn from experts in consumerism in healthcare, inclusive patient care systems, population health, and other pertinent topics.
Healthcare needs to and is looking for people that have skills in consumerism, engagement, technology that's nimble and mobile, and also people who have skills in terms of understanding socioeconomic impact and understanding communities.
So I really appreciate your opportunity to really elevate the healthcare discussion and get us out of standardization.
Reclaim healthcare's human-centered approach and create more supportive work environments for nurses and physicians.
In 10 minutes, a great nurse knows more about you than your family does. And I think about it, and that's personalization, right?
So it's not just the person with the diagnosis, it's what's around them, their family, their friends, and that is part of their whole being.
I think we just need to consider that this is a person coming in instead of a patient and just looking at, whatever bullet points are on my diagnostic sheet.
You won't want to miss our panel discussions on consumerism in healthcare, post-pandemic challenges, inclusive workplace culture, and modernizing healthcare.
I have never in my career been more proud to be part of the healthcare industry than I have during this pandemic.
I think COVID, for the most part, has really accelerated the need for us to really change and look at healthcare as a horizontal, as an opportunity for us not to be so siloed, not to be so detached from society.
So what I would argue is that we have to stop thinking about who the consumer is, and we have to understand why they are consuming. And this is as relevant in healthcare as it is in the world of consumer products.
When it comes to the non-clinical skills for me, that's where we need to evolve. And first is management.
Register now for the Healthcare in the Age of Personalization virtual conference and get complimentary online courseware at GLLG Online Academy. Network with like-minded professionals and find inspiration for your own practice.
Because ultimately, personalization of care for a patient isn't just an abstract idea. It's a matter of life or death.
All we ever keep talking about is how we need to treat each other like humans. Boy, I hope everyone has been waking up to realize we got a lot of work to do.